If you are a young male or female, less than 50 years, and having poor urinary straining, hesitancy, and frequency, yes, then you may be having stricture urethra. I am Dr. Kumar Prabhu, consultant urologist and head of the Department of Urology at NU Hospitals, Bangalore. So what is stricture urethra? There is a narrowing in the passage connecting between the bladder and the external orifice. In men, the urinary tract, the urethra, measures around 18 to 20 centimeters long, whereas in females it is around 4 centimeters. How is this condition diagnosed? This requires simple urine analysis, urine flow test, ultrasound abdomen to know the amount of urine remaining in the bladder after you pass urine, and also to assess the thickness of the bladder wall and any upper tract changes in the. If all these suggest that you have a poor urinary stream, then we do specialized test in males, what is called as retrograde urethrogram and micturating cystourethrogram. This is done in the radiology department, where a dye, that is a contrast material, is used to delineate the urinary passages. In women, you only do an MCU and not RGU, that is micturating cystourethrogram. These studies will show us where there is a narrowing, the extent of narrowing, and we can plan definitive surgical procedure for the patient. Stricture urethra affects about less than 1% of the population, but it is important to differentiate it from other common condition affecting men, that is a prostate enlargement. So specialized test and examination will help us in differentiating between the two. What are the treatment options in these conditions? So once the diagnosis is confirmed, based on the findings of the imaging studies which I mentioned, the retrograde urethrogram and NCO, that is micturating cystourethrogram, if the stricture is in the part of the urethra called bulbar urethra, then it is less than 1 centimeter, then we can do a endoscopic procedure called VIU, that is visual internal urethrotomy. This is a quicker procedure where the patient can stay in the hospital for a day and then the catheter is removed after 3 days. But if the stricture is affecting both the parts of the urethra, that is the bulbar and penile urethra, and it is more than 2 to 3 centimeters or sometimes as long as 15-16 centimeters, then you would require urethral reconstruction using buccal mucosal graft urethroplasty. Here the graft is taken from the oral cavity of appropriate size and then it is patched in the urethra. This is done by open technique, where you make a small incision between the scrotum and the anal orifice and the urethra is made enlarged. Here the patient is kept on a urinary catheter for 3 weeks and then the catheter is removed. These are the various options for stricture urethra. In females, since the urethra is 4 centimeters, we put a graft on one side. It's called BMG urethroplasty in females. This also has good results. If you have any doubts of the clarification, you can write down in the comment section and we'll get back to you. Thank you.